detailed work. The first thing I do want to show y'all for therapists and for clients, this is a very good way to test knee issues and how to properly assess it and fix it. So what I like to do is, a lot of knee issues are caused whenever people are over dominant on the front of their legs and they're hunched like this. That's putting so much pressure on the front of your knees. So one simple test I like to see is if their glutes are firing properly. So what I'll have them do is I'll usually have them sit on a chair, and if you can see, you'll put your toes up like this, and then we're going to come straight up, maybe hold on to something so you don't fall, and then come straight up through your heels. This actually helped me, notice that that'd be the reason why my knee was hurting. So I targeted my glutes and hamstrings and strengthening, and it helped my knees a lot. So I do have a massage video to show you guys. So if you just hang on one second. All right, so today we have Brittany. She's one of our receptionists here at Natural Forces. One benefit of working here, you get worked on. So you'll see she actually has a circle here, a red mark. That's actually from cupping therapy. It does really good. You can look up our video on cupping. So what I like to do, anytime their knees are hurting, we're going to show some good techniques to loosen up the entire muscle. I don't want to just loosen up the outside. A lot of therapists will tend to focus more medial, which is in the middle, towards lateral on the outside. You got to make sure you work on the inside too, because the inside will pull on the outside. Also, you got to make sure to work into the glute, because that's where the sciatic nerve runs through all the way down into your legs. So Brittany actually has knee issues and tends to hurt on the inner and outer of the leg. So one of the first things I'm going to address is, a lot of therapists are told not to work in the middle, and that's contraindicated. Well, if you do it correctly, it's okay. They just teach that for liability purposes. If they have all their therapists, working in the middle and hurt someone, then that's not going to look good. So what I'm going to show y'all, when you go across the muscle, you'll feel the little tendon right in there. What I like to do, a little bit of passive release. You can actually, when you feel like you're on it, sometimes it helps to communicate with your client. It feels pretty tender in there. And just do a passive release. Passive release is where I'm hitting on some of those pressure points, and I'm releasing it by using her leg. Passive release is really also good if you have struggle getting deep enough in a massage. Use their body against them. And you notice one of the things is you get the muscles run up and down alongside each other. So if I just go straight up and down like some therapists, it's not going to do as much as if I go across each muscle, separating the fibers away from each other. I always say, work within your client's pain tolerance. Definitely inside these areas. Maybe work pretty light the first time, have them come back in, a couple days just to see how it responded. So as it starts to get a little softer, you'll feel, it means that it's releasing a little bit. Is that less tender than it was? She's either actually less tender, or she's just telling that for the sake of the video, which works for me. So another way I like to do things is, it's good to work, don't just work the muscle when it's flat. You want to put the muscle in different positions. So I like to shorten the muscle, do a press with my fist, and go down at the same time. You can do that throughout. Now, if you're a client watching this, when we loosen these up, it'll stop pulling so hard on the knee. We can go on and on about all the different reasons a knee can hurt. But for the sake of this video, we're just going to assume it's just general tightness. Now, if it's tears and stuff like that, that's a different story, and you need to go to get an MRI and see where that is. So I also see that her glute right through here, piriformis area, really, really, really tight. She probably agrees. So I like to use a forearm in the area. Just kind of press up towards the sacrum. So at a diagonal, go in this direction, right into the piriformis. Again, passive release. Does that feel good and bad at the same time? Mm-hmm. Okay. The sciatic nerve runs through here, so we calm it down a little, then the pain doesn't radiate as much. You know, a lot of people don't think that massage therapy can help with knee pain because it's not a muscle. Well, there's a lot of muscles that connect to it, and tendons that if they're not pulling on it so hard, it might help a lot. Another aspect of this I like to also treat is the calves. Again, I don't like to just drag straight up. You know, you see a lot of therapists stripping muscles out. I was one in the past. I like to actually go across the muscle. One, it's less painful to do it this way. And you notice I'm holding her ankle a little bit, not too hard that it's hurting her ankle, just to keep her from kicking me in the face. That is not the only reason. And then I saw this other thing in a good video before on by Eric Dalton for the plantar fascia through here. The fascia around that can cause a lot of the plantar fasciitis, so I like to do this technique. I'm pulling this way as I'm pulling that way. And we'll use it, and I like to grab the big toe, pull straight down, and lean in, stretch it out good. Another exercise I try to give clients is actually to do calf raises, because a lot of runners, they tend to, when they're running a lot, they're lifting their toe up a lot, which is tensing that shin. Well, that's why they get the shin splints, or what they believe are shin splints. Well, if this is getting too shortened, if we shorten this a little bit, it'll take the pressure off. So it's not only about stretching the calves, it's about exercising them as well. One way, and I'll do this one pretty quick, you can, because I want to show some face up work as well. One thing I like to do as well is work across the IT band. Don't be mean and strip out an IT band. That's never going to release. That tendon doesn't release. Now the muscles around it, now that's a different story. When I'm going across the IT band, I'll soften up here and then I'll get deeper here. One of our therapists, Bethlehem, is our camera lady today. So if there's any issues with the camera, you can blame her. She's like, I'm not getting paid for this. All right, so what I like to do, go across. Remember, lighten up over the IT band and sink in. Again. And try to follow it all the way up. And then you can also, what I like to do is sink right straight down onto the piriformis area, onto the glute. They may actually feel that stretch in their groin. All right, and then wake the glute up a little bit, because like that one exercise that I was showing you in the beginning, she does struggle with. So we want the glutes to get stronger to help with that pain. Then, what I'll have you do, Bethlehem, if you'll come on this side. So what I like to do is bring my outside knee, so the knee closest to the feet of the table, and we're going to raise the leg up. I'm going to slide my leg under, and now I'm going to have her push her hip down, and then go lean in slowly. Don't do this if they feel it in their knee, and don't do it if they feel it in their lower back. You want to release those muscles first. If they feel it in their knee, just raise up a little higher sometimes, or there's a side-lying way to do it. How's that feeling? Stretching? All right. Last thing I'm going to show y'all face down is a way to get into the groin from the other side of the table. I really like this technique, so have you come on this side. Now, depending on comfort level with your client, make sure you communicate. Maybe not do this the first time, but you always want to communicate. It's very important. I like to get my forearm, drop under, and come up. They should feel that. How's that feel? That's her way of saying it feels amazing. And relax. So when I do trigger points, here's a bigger one. When I do trigger points, you see some trigger point therapists will hold it for like 30 seconds until it releases. I don't like to be that mean. I like to more kind of pump the blood. So hold for like 5 to 7 seconds, release. Kind of lets them breathe through it a little better. Not that that's the right or wrong way to do it, that's just the way I prefer. All right, in just a second, if you hang on 1 second, we're going to turn her over. So, all right, now that we got her face up, it's really important to do both sides. Remember, work the whole muscle all the ways around. Warm it up a little bit first. What I like to do, like I said earlier, is go across the muscle. So I like to get my forearm like this, kind of like a windshield wiper, kind of go like this. So go across. When I feel a more tense spot, I'll pause for a second. One little neat trick with trigger point, that if you have trouble finding the spots or getting right on it, when I feel it, like say if I'm gliding across and I feel a trigger point, sometimes we tend to slip off. So like back up a minute and then sink in. And then go across. Now there's a good trigger point right here in the middle of the quad that sometimes you'll feel radiate into the knee, but it helps release it. Do you feel that, Brittany? Is it radiating or is it localized?
It's pain.
It's just pain, all the above. And then I see a lot of therapists don't do the full leg, they kind of just stop here. I've even seen some schools not teach to go all the way up the leg keeps going. So, work it all the way across. You can actually get to some good hip work on the outside. Notice I'm holding her leg. And last, what I'm going to do is show you all a little bit of the way to how I get to the groin. So I like to pull their knee out. And the same thing, I'm going to work across the leg. Some clients, you know, if you, like I said, build that relationship when it comes to the groin. But it is good to get up high, but I like to go across, work within their pain level. Remember, they take that deep breath in, back off a little bit, then sink back in. Doing okay? All right, it's really important to release the inside too. And then right here, it's a good spot. She's like, that's not a good spot. It's an effective spot. All right, and then I like to wash it out. Just kind of, anytime I beat someone up, and there's more detailed work, but for the sake of a video, I'm gonna kind of briefly go across it, see, just to kind of calm this down. After hurting something, I always try to sandwich it and be nice. And then since I did one quick groin stretch, and then this one will be over, just to kind of stretch out if you tend to beat something up, you want to kind of stretch it a little bit. Don't hold on top of the knee, hold the quad, and just lean in. This is a good way to test their glute strength as well, because if she pushes me with her heel, so push me with your heel, and let go, and again, and relax. Does it feel like it loosened up for you a little bit? Less pain?
Yeah.
All right. Again, she may just be telling me that for the video, but if that, you're employee of the week. But I do appreciate you guys watching. I hope y'all made it all the way through. If you liked it, please leave a like. And if you have any suggestions, comments, we're all in this together. Comment below. Thank you so much for watching, and please subscribe and share this with your friends.